Welcome to Dr. Health Hub, where every episode begins with a doctor tip you can trust. Today we're talking about something where minutes really matter. Stroke. What it is, who gets it, what warning signs you must not ignore, and what real treatment and prevention look like.
Yes, stroke is one of the top causes of death and long-term disability. The good news is many strokes can be treated better, and some can be prevented if people recognize the signs early and act fast. Let's keep this simple, calm, and clear.
So, doctor, in easy language, what is a stroke?
A stroke is like a brain attack. Part of the brain suddenly stops getting enough blood and oxygen. Most strokes are ischemic strokes, where a blood vessel in the brain is blocked by a clot. Some are hemorrhagic strokes, where a blood vessel bursts and bleeds into or around the brain. There's also TIA, sometimes called a mini-stroke. Symptoms start, then fully improve, but it is a serious warning that a major stroke can happen. All of these are emergencies.
Who is more likely to have a stroke? Is it only very old people?
Stroke risk does increase with age, especially after 55, but it is not only an old person's problem. Risk is higher if you have high blood pressure, diabetes, high cholesterol, are a smoker, have obesity, move very little, drink a lot of alcohol, or have heart rhythm problems like atrial fibrillation. Family history, previous stroke or TIA, and some medical conditions also increase risk. Men have slightly higher risk at younger ages, but women are strongly affected too, especially as they get older. Even young adults can have stroke if risk factors are not controlled or if they have certain heart or blood vessel problems. So anyone with these risks should pay attention.
What usually causes a stroke? Can you explain it simply?
For most ischemic strokes, the cause is a clot blocking a blood vessel. A clot can form on top of cholesterol plaque in a neck or brain artery, or it can form in the heart, for example, with atrial fibrillation, and travel to the brain. For hemorrhagic strokes, common causes include long-term high blood pressure that damages the vessel wall, bleeding from an aneurysm, or fragile vessels, sometimes made worse by blood thinners or certain drugs. Often, it is years of uncontrolled risk factors quietly damaging the vessels.
People hear stroke warning signs everywhere, but they still get confused. What are the key signs we must not ignore?
Think sudden change. Sudden weakness or numbness of the face, arm, or leg, especially on one side. Sudden drooping of one side of the face. Sudden trouble speaking, slurred speech, or difficulty understanding others. Sudden trouble seeing in one or both eyes. Sudden trouble walking, loss of balance, or severe dizziness. Sudden, severe headache with no clear cause, especially if it's the worst headache of your life or comes with other symptoms. Many experts use FAST or BFAST, face drooping, arm weakness, speech difficulty, balance problems, eye changes, time to call emergency. If you see any of these in yourself or someone else, do not wait. Call your local emergency number immediately.
So, if someone has those signs and comes to hospital, how do doctors confirm it is a stroke?
First, we move fast. Time is brain. We check airway, breathing, circulation, blood pressure, and blood sugar right away. Then we scan the brain urgently. The most common first test is a CT scan of the head. It is quick, non-invasive, and helps us see if there is bleeding. Sometimes an MRI is used, especially to see early ischemic stroke, if it can be done quickly. We may also do CT or MR angiography to look at brain arteries, ultrasound of neck vessels, heart tests, and blood tests. All of those are usually non-invasive. In some cases, a catheter angiogram, more invasive, is used for detailed images or before certain procedures. All of these decisions are made by stroke and neurology teams. For the public, the key message is get to the hospital fast, so these options are still possible.
Once you know it's a stroke, how is it treated? Can you explain the medicine options first, then the more invasive options?
For an ischemic stroke from a clot, the goal is to restore blood flow as fast and safely as possible. Non-invasive or medicine-based treatments include clot-busting medicine through a vein given within a limited time window from when symptoms started if the patient is eligible. Then, depending on the type of stroke, starting antiplatelet or blood-thinning medications to prevent more clots. Careful control of blood pressure, sugar, oxygen, temperature, and fluids in a stroke unit. For some patients with a large artery blocked, there is an invasive option called mechanical thrombectomy. A specialist passes a thin tube through an artery in the groin or wrist up to the brain and removes the clot directly. This is done only in selected patients and within specific time limits. For hemorrhagic stroke, treatment focuses on lowering very high blood pressure carefully, stopping or reversing blood thinners when safe, managing brain pressure. Sometimes surgery is needed to remove blood, secure an aneurysm, or relieve pressure. All these decisions are made by stroke and neurology teams. For the public, the key message is get to the hospital fast so these options are still possible.
What happens after the emergency phase? What kind of problems can stroke leave behind?
Stroke can affect many parts of life. Weakness or paralysis on one side of the body, trouble speaking or understanding language, difficulty swallowing, which can lead to choking or chest infections, problems with vision, balance, memory or thinking, pain, stiffness, or muscle tightness, changes in mood, such as depression, anxiety, or irritability, higher risk of another stroke or heart problems. This is why stroke recovery needs a team. Physical therapy, occupational therapy, speech therapy, mental health support, family support, and follow-up with doctors. Treatment does not stop when you leave the hospital.
Now, let's talk about prevention. What can people do to lower their chance of stroke?
There is a lot we can do. Keep blood pressure under control. High blood pressure is one of the biggest stroke risks. Check and manage blood sugar if you have diabetes. Manage cholesterol with healthy food and medicine if your doctor advises. Stop smoking completely. Limit alcohol. Move your body regularly with safe exercise most days of the week. Eat a balanced diet with more vegetables, fruits, whole grains, healthy fats, and less salty, fried, and processed foods. Keep a healthy weight and good sleep. If you have atrial fibrillation or certain heart problems, take the blood thinners or other medicines your doctor prescribes to prevent clots. And know the stroke signs so you can act fast if something happens.
Can you give simple do and don't points for our viewers?
Do treat sudden face droop, arm weakness, or speech problems as an emergency. Call your local emergency number immediately. Do check your blood pressure, sugar, and cholesterol regularly and follow your doctor's plan. Do take your heart and blood pressure medicines as prescribed. Do live smoke-free, move daily, and keep alcohol low. Do go to the hospital even if stroke symptoms start to improve. Early treatment still matters. Do not wait hours or days to see if it gets better. Time lost is brain lost. Do not drive yourself if you think you are having a stroke. Use emergency services. Do not stop blood pressure pills, heart medicines, or blood thinners on your own. Do not rely on massage, home remedies, or herbal products instead of emergency care when stroke symptoms appear. Do not ignore brief stroke-like symptoms. A TIA is a serious warning.
For someone watching who has risk factors and feels scared now, what would you say?
I would say feeling worried is okay, but use that worry in a smart way. Check your numbers. Control your blood pressure, sugar, and cholesterol. Stop smoking, move more, and eat better. If you have heart rhythm problems, follow your treatment. Learn the stroke signs. If something sudden feels wrong, act fast and call for help. You cannot change every risk, but you can change many of them.
Thank you, doctor. And to everyone watching, this video is for education only. It follows the spirit of major stroke guidelines, but it is not personal medical advice and not a self-treatment guide. If you have stroke symptoms or are worried about your risk, please contact your emergency number or speak with your own doctor or stroke clinic. Your health is your wealth. Stay tuned for the next doctor tip you can trust.